This is Alex Smith, who was 26 years old when he died in June 2017. Alec was diagnosed with type 1 diabetes when he was 23, meaning he needs to take insulin every day to survive. But turning 26 meant he was no longer eligible for his parents' insurance coverage, and his monthly cost for insulin and supplies skyrocketed. The insurance now available to him was a $7,600 deductible and a $440 monthly premium, which Alec couldn't afford, so he decided to temporarily forego insurance coverage and pay for insulin with cash, which is unfortunately far beyond his financial capabilities. He decided to ration the amount of insulin he took until he had enough saved to purchase his insurance, an unsustainable and dangerous practice. Alec died alone in his apartment of ketoacidosis, a dangerous side effect of diabetes that occurs if your body does not receive enough insulin to survive. Alec's mother, Nicole Smith Holt, wants you to know that my son is not a statistic. He would be here if his life-saving medication was priced at a reasonable rate. According to Stat News, 18% of diabetics worldwide and 26% of Americans had rationed their insulin in 2018. There are countless stories like Alec's, needless deaths caused by the greed of drug manufacturers and private insurance companies. But one preventable death of tens of thousands should be enough for us to advocate for the reduction of drug prices and the liberation from a system that is supposed to provide care to our most vulnerable, but instead only cares to line its pockets. Insulin is a necessary medication that should be affordable to everyone, and possible solutions should be considered to solve its price gouging. In 1923, Canadian medical scientist and Nobel laureate Frederick Banting discovered insulin. He refused to put his name on the patent, feeling it was unethical for a doctor to profit from a discovery that would save lives. The patent was sold by Banting's co-discoverers to the University of Toronto for $1 because they wanted everyone who needed the medication to be able to afford it. According to Vox, by 2016, the average price of insulin per month rose to $450. The U.S. is a global outlier on money spent on the drug, representing only 15% of the global market and generating almost half of the pharmaceutical industry's revenue. Jing Luo, a researcher at Brigham and Women's Hospital, told Vox in 2017 they're doing it because they can, and it's very scary because it happens all the time in all kinds of different drugs and drug classes. In countries with single-payer health systems, for example, England, the government has an agency that negotiates directly with pharmaceutical companies. In America, healthcare is approached as a free market, and drug companies fight separately over prices with a variety of private insurers across the country. Meanwhile, Medicare, our largest buyer of drugs, is barred from negotiating drug prices. According to a 2017 Lancet paper on the gouge, older insulin has been successfully replaced with newer, incrementally improved products covered by numerous additional patents. Yale endocrinologist Cassie Lipska says soaring prices for these new formulations are out of step with how much they improve treatments for patients. In a January 2019 study by the Healthcare Cost Institute in Washington, D.C., it was found that the annual gross insulin cost for patients with type 1 in the U.S. essentially doubled from 2012 to 2016, but the average daily insulin amount for these patients increased by only 3%. Furthermore, according to a recent study, U.S. spending on diabetes drugs increased from $10 billion to $22 billion per year between 2002 and 2012, and most of that cost was due to insulin. Lantus, one of the most popular insulins on the market, has increased in price for a 10 milliliter vial from under $40 in 2001 to around $275 as of 2017. According to GoodRx, a company that finds coupons and discounts on prescription drugs, another of the threats to many diabetic patients is incomplete insurance coverage. The first is when insurers and payers adjust their list of covered drugs to favor cheaper drugs for their member populations, which results in cutting coverage for some drugs that are more popular. This made headlines in 2017 when CVS Caremark dropped coverage of Lantus in favor of a biosimilar called Basaglar. Consumers who used Lantus were faced with the choice of switching to another brand or paying full price for their drug of choice. Another is how people who use insulin have Medicare Part D prescription coverage often find themselves in the donut hole, where they've surpassed their initial Part D coverage limit but have not yet reached their out-of-pocket maximum of $5,000, and during that time they must purchase the insulin themselves, although at a 65% discount. The gouging of insulin prices is one of the most egregious offenses of our healthcare industry today, and while broad public sector solutions have been offered in the past, it is clear that something must be done to right the cruelty and greed. In March, Virginia lawmakers passed a bill that would force insulin manufacturers to cap costs at $50 per month. It was proposed by Democratic Representative Lee Carter and created one of the lowest caps in the nation. The bill prohibits health insurance providers from charging a copay over $50 a month for a 1-month supply, or from allowing or requiring a pharmacy to charge any more. During a Senate hearing, Carter said, "The bill is aimed at providing relief for those folks who have health insurance but can't afford to use it, and that is a vast swath of Virginia's population. While this is certainly a step in the right direction, it doesn't cover everyone, most notably uninsured patients." Another solution has been enacted by corporation Eli Lilly, lowering costs to $35 per month due to the financial strain of coronavirus. However, while some advocates cheer the decision, others wonder why the drug maker hadn't taken steps to cut costs now when diabetic Americans were rationing their supplies even before the pandemic, according to Kaiser Health News. The Lilly Insulin Value Program allows anyone with or without commercial insurance to fill their monthly prescription of Lilly insulin for $35, but this still does not cover all patients. According to Associated Press, because of federal guidelines, seniors with Medicare Part D plans are not eligible for the discount. It is clear that the only fair solution to this crisis is for the government to institute a single-payer national healthcare system, as it would provide coverage to every American and drastically lower the price of prescription drugs. According to the Don R. McCann, MD, of Physicians for a National Health Program, single-payer national health insurance would resolve virtually all of the major problems facing America's healthcare system today. Representative Pramila Jayapal's recently introduced Medicare for All Act 2019 is a powerful and comprehensive plan to make healthcare right for all Americans. It includes a key provision modeled after the Medicare Negotiation and Competitive Licensing Act, which would lower drug prices for all Americans by allowing the government to negotiate with corporations, according to Common Dreams. If a company refused to lower the price and threatened patients' access to the medication, generic competition would be allowed using a competitive license. According to economist Dean Baker, the U.S. is likely to spend more than $450 billion, 2.2% of our GDP, on prescription drugs this year. We would likely be spending less than $80 billion if all drugs are sold in a free market without patents or related protections. In conclusion, the number one reason for the high cost of insulin is the presence of a vulnerable population. The companies are doing this because they can. The U.S. has the most expensive healthcare system in the world and is the only developed country without a system of universal healthcare. Don R. McCann, MD, states, "The story of insulin can serve as a proxy for why our system fails so many of us. Public sector solutions would certainly be helpful, but they are not enough, because all of the other severe deficiencies in our healthcare financing system would still be in place. We need a fundamental change from a private business culture to that of public service. A well-designed single-payer model of Medicare for all would do precisely that. In contrast, merely adding a public option, such as Medicare for some, would fail to change the culture and would tear down the public financing structures that we do have in order to further privatize healthcare financing and leave us even worse off. The price gouging of insulin is killing Americans, and we need healthcare reform now." 2/3 of voters support Medicare for All, a system that would uproot the privatization of medical care and insurance and make sure stories like Alex are a product of history, not the future.